Guys, welcome back to Medical Coding with Blue. Today's episode is all about when you should query your providers in medical coding and some tips to performing provider education. If you are brand new to my channel, welcome. I am Blue. I'm a medical coder. Okay, guys. So I got this comment, and thank you to the viewer who sent in the comment, and I'm going to read the comment and we're going to get into it. So here we go. So the viewer says, Blue, can you do a video, or have you done a video on provider education? I've actually done several. Please be sure to look through my videos. I work for a facility and our doctors' documentation is very lacking. So much so that we query them at least once per week. I would like to approach my manager on starting some kind of monthly provider education and would love your input on how to best go about this. All right, so let's start with the queries. Now, AHIMA on their website has a lot of guidance about proper queries, appropriate queries, and things like that. They also say, and I'm paraphrasing, that you got to pick and choose your battles when it comes to these queries. The only time that you should be querying is if it is going to affect the code selection, right? And I'm going to give my mother-baby example here in a minute. If it's going to affect the diagnosis selection, if it's going to affect the procedure that is being selected, if you can't code without knowing, that particular information, that's when you want to make sure that you query. Now, are there times when you don't necessarily have to query? Of course. If it is a follow-up on an injury patient, they should be stating what the injury, the modality of the injury was. But if they don't on that follow-up, it's okay. I personally don't like it, and I tell my providers I want the injury and I want how did it happen, so that way I can keep that external cause code throughout. Now, when it comes to the other things like place of occurrence and what they were doing, that doesn't need to be on the subsequent encounters. But if you were to say, well, I'm new to this ortho clinic and I see that this is a follow-up appointment and they have a fractured wrist, but I want to know how was it fractured, so I'm going to send a query. That's wrong, because there's nothing that indicates that you need to have that external cause, okay? Now, I like external causes because I think it's appropriate and it makes everything full and complete, because sometimes these injuries are related to workman's comp claims or other accidents and things like that. So it does need to be there. At least it's just my opinion. But there's nothing that is written there that it has to be there, that it has to have an external cause, I just like it for complete documentation purposes. So that's what I educate them on, and we'll get to that in a minute. But that is an example of that you don't have to query, and that's in the subsequent, okay? Those subsequent encounters is what I'm using as an example. You don't have to query at that point for that, okay? Now, the same thing with obesity. Now, would it be great if they had the BMI? Yes. But if they don't have the BMI, could we code the obesity without the BMI? Absolutely. But that's another thing that you can use to talk about in a provider education, right? It's the same thing if they're like a smoker and that kind of thing. Which kind, you know what I mean? Because there's several different, there's chew and there's, there's all these things. Do we need to query for that? No. If they say they use tobacco, we can use that Z code for the tobacco and we can just go about our day. However, when it comes to specificity of codes, would it be great if they told us which kind they used? Yes, but at the same time, this goes back to when you get in front of them in a class, okay? But those are the types of things that you're not really having to really worry about when it comes to like the detail. Would it be great? Yes, but it's not necessary, okay? So that's something that's not necessary. Now, let's just say, for instance, you're working in the podiatry clinic and the patient's coming in because they have corns on their feet, right? And the provider has to go in and they have to remove those corns. Well, you need to know how many corns were removed, because that's specific to the procedure code. So if the provider doesn't have that in the documentation, that's when you have to query, hey doc, how many of these were there, right? That's when that's important, right? Same thing with mother-baby, weeks of gestation. if the mother comes in and she's pregnant and they don't know how many weeks that mother is, or they just say, mother is pregnant here for follow-up, everything's okay, and they don't tell you how many weeks that mother is, that's going to affect your ability to be able to select an appropriate code. Could you select unspecified weeks of gestation? Sure. But then when you do stuff like that, that's asking and begging for an audit from the insurance company because you're selecting those unspecified codes. So when it comes to something like that, you want to make sure that you are asking them, that's when you can send a query about something like that. Hey, we need the weeks of gestation. How many weeks is this mother, and that kind of thing. So, of course, you want to use your templates and you want to use appropriate wording. You never want to lead the witness. That's what we have to do. These are legal documents, and we got to make sure that we are on our P's and Q's. We're not leading the providers, okay? When it comes to diagnosis specificity or what happened in this procedure, that type of thing. We need to look for clinical indicators, things that are telling us that, okay, this is what it was, but, where is it here in this documentation? So be very careful when you are querying, okay? And make sure that you are following the rules for appropriate queries. And you can find that information on the AHIMA website at ahima.org, okay? So the other thing is this. If, let's use the mother-baby example one, okay? Your providers in the OBGYN clinic are not documenting weeks of gestation. This is something, if it's a big problem, right, and they're all doing it or they're not being consistent, that's when you can send out a coding tip of the week. Now, would it be better if you can get in front of them? Absolutely. But because it's business and there's really no time sometimes to sit down and talk and chit chat with each other. But what we can do is send out an email. So what I say is this is what I do for my providers in ortho and podiatry. I send out coding tip of the week. And what it is a very brief message once a week. And I try not to do it on Monday and I try not to do it on Friday because Monday or Friday brain, no bueno. These doctors have surgeries and they have all these other things that they're doing. Their brains are elsewhere, okay? You want to set these to sending them out consistently on a routine basis, either Tuesday, Wednesday, or Thursday. Those are the best days because it allows them to start the week or either end the week, and they're not having to worry about all this other stuff. If you catch them this way, you'll be a lot more successful, okay? So what I recommend is go ahead and write out everything that you want to write out, okay? Don't send it out yet, but write everything that you want to say, right? Then I want you to cut it in half. What this is going to do is going to get rid of all those filler words. It's going to get rid of all the other extra fluff. Oh, I hope everybody is doing fantastic and great. Every time I get an email, it says, "Hi, Blue. I hope everything is going wonderful." And I was like, okay, what is it? What? Just tell me, So get right to the point, okay? It's okay to say yes, good morning, hello, but make sure that you go right to the point because they don't have time, okay? They have to get in and get out, and they've got to be able to see what is it that you want. If you're going to send them a huge long email talking all this fluff and stuff, they're going to ignore it, okay? So write out your email, cut it in half. That's going to get rid of all that extra fluff there, okay? Then you see that half of an email, and you're going to cut it in another half, okay? So now you have a quarter of what you started with, and that's your meat. That's the meat of the potato. So you work with that, okay? You make it as to the point as possible, and you let them know. Upon reviewing these encounters, a lot of the weeks of gestation on the patient are missing. So we need to have this information so that the most appropriate specific code can be selected. If you have any questions, please advise. Boom. And if they say, okay, that's great, because if you send them a whole bunch of queries about the same issue, they're going to say, why didn't they just tell me this in an email? Why do we have to go through all of this? Okay. And that's when you can, by sending that out, then now everybody's on the same page. It's not just one person. It's not just one provider. It's everybody. Okay. Because trust me, if you send it to one, they're going to know it's about them. But if you send it to all of them, they're going to say, oh, is this about me? And then they're going to start looking at what they're doing. Okay. So they're going to be able to pay attention to that. Okay. So here's the other thing too. I know a lot of facilities are like this, and I personally do not like this because I know my capabilities, I know what I do, and I know my knowledge base, okay? Obviously not everybody is the same. I get it. And if your facility has specific rules about emailing providers, oh, you've got to copy this person, that person, this person, a third person, and a fifth person. Guys, if you have to, let's just say, for example, you have to copy your supervisor and your lead and the other team lead, okay? Now, if you're sending out an informational email like this is just a coding tip of the week, okay? If you have to send something like this, it is unnecessary to put them in the CC line. Don't do it. Why? Because here's the thing. If they start seeing their names in the department plus the chief clinic name and all this other stuff, if they start seeing all that stuff, then it's just like, oh, well, they're getting after us, and now everybody knows. Okay, so let's just do it this way, right? Let's just keep it simple, okay? You're gonna you're gonna put all the providers from that clinic in the 2 line, okay? Then in the BCC line, and if you don't know how to do that, then you need to look on YouTube because there's plenty of videos about that. Get that BCC line on there. That's where you put your supervisor, your lead, anybody else that's not pertinent to this particular email, these providers, you put those people there, okay, on that BCC line, because it's unnecessary for all of that to be showing in front of everybody, okay? I don't like that. I've never liked that. I've never liked, well, I want to be copied this person. No. Because what does that look like? It looks like you're calling them out for doing something. No. We need to keep it simple. And this also builds trust with your providers. Okay, this person's coming directly to me, so we know. But guess what? You have a paper trail now that says, okay, if you're being consistent and you're sending out coding tip of the week on Tuesday or coding tip of the week on Wednesday, then you have this thing. Okay, I've been telling them, and this is what's been happening with the documentation. They will improve because this is exactly what I had to do when I got into ortho. Now, I had a partner at the time, so we did this together. We sent out the coding tip of the week together to all of the providers, and wouldn't you know it, their documentation started to improve. We started to get all of those details in there because it was a constant thing, and you have to be consistent with it. And that's what they like, is when you're consistent, okay? Now, if you want to meet with them in person once a month, this is fantastic because then you guys can have that one-on-one. And what I recommend when you're going into these provider education meetings, you pick 3 topics. It doesn't matter that, oh, there's so many things wrong. You need to pick the first biggest 3. Your biggest 3. Well, no, what about 4? No. 3. 3. Because if you put any more than 3 on this agenda, it's just going to fall on deaf ears. You have 2 minutes to keep their attention. Once you get in that door, you have 2 minutes. Now, when you go in, I always like to make sure that when I do a slide deck that I have 10, no more than 12 pages. And 12 is just because it's the first page and it's the last page, the contact page. The contact page is very important. That last page, it should have your references if you want to go that far. But you should at least have your name with your credentials, okay? Or credential, it's okay too. Your office number and your email address, okay? So how they can reach you. Because here's the thing. When you go in and you talk to these providers, a lot of times you're going to get the bobbing head dog, right? Everybody agrees, everybody understands. Yep, everything's cool. Meanwhile, if you have evolved, right? If you know that you listen to Medical Coding with Blue and she says that people don't always express their questions in these meetings, then you're going to know that sometimes they're not going to ask you in front of their peers. They will not. Some will, some won't care, and they'll be like, well, I'm going to ask anyway. But some of them, they won't. So you have to learn to watch their body language, and you have to learn to watch how they react to what's going on. Now, here's the thing. 10, no more than 12 pages, right? But 3 topics in those 10 pages. Let's just go with 10, okay? 3 topics in 10 pages. 3 only, okay? I don't care if it's that you're saying, okay, well, you know, here's a tip or here's an example. You know what I mean? You got to make it in 10 pages. 3 topics only at a time. And if you do 10 pages, guess what? Because I like to always come in with copies of the slide deck, because I don't trust something always happens with the projector. There's always a technical issue, and then all of a sudden we're waiting around. I don't like to wait around. Okay? I don't like for people to be late to these meetings. I do not like to wait around. I do not like to have all this other tomfoolery going on. I like to get in and get to the point. We're not going to sit here and play games with this projector. So what I do is sign in. Please sign in. Everybody needs to sign in. You need to make a sign-in sheet, okay? And you keep this sign-in sheet, because that way you know who showed up to that meeting. So that way they can't tell you, oh, well, I didn't know about that. No one ever said that to me. Really? Because on this day, and you need to make sure that you put a title. What was there? You know, what was the topics covered? You could put the title, and then you could put the 3 topics that y'all are going to discuss, okay? And then you could put, you know, their name and where they sign in, stuff like that. Tell them to sign in and take a slide deck. So now you have the slide decks, okay? I always tell my providers, I know what I wrote, so now I'm going to have you all read. So guess what this does? Okay, I get very excited when I start talking about education. This gets them involved, because how many times have you been in a provider education meeting where the coder's standing up there and they're giving their presentation and things like that, and you see the doctors like this, nodding off, because they don't have to be engaged. There's nothing that is pulling them into this conversation other than the fact that they're supposed to be there and they showed up. They're there, they showed up, they did their part, okay? Now, if they fall asleep, because sometimes people listening to somebody's voice makes them fall asleep, right? So this is what you have to do. What we're going to do is we're going to go around the room, or I can call on folks, however y'all want to do it. But you're going to somebody's going to read a slide, and then we're going to stop and discuss it, okay? And that's exactly how you run that class, because this way now everybody has to like pay attention. Like, okay, is it my turn? Is it my turn? Because nobody wants to be called out for not paying attention. So you have effectively done 2 things. You've engaged the providers, and now you have their attention. And now their brain has to pay attention too, because it's different people that are speaking. It's not just one person, where, you know, if you have a very monotone voice, you know, people might want to fall asleep, you know, or if you have a high-pitched voice, you know, people will be like, oh, you know. And so, but if you have different people speaking, okay, I know my colleague here, and it's their words. They're hearing these words, but it's coming from this person, or it's coming from this person, or it's coming from this person. Oh, I remember when so-and-so said that. Oh, I remember when so-and-so read that slide. Right? So, and like I said, this works perfectly over 1 hour's time, okay? That's essentially giving you enough time to be able to discuss everything. And as you're going through these things, when they finish reading the slide, then you say, okay, well, and then let me expand on that, or let me go ahead and reiterate something else I saw, or something else. And then you go on to the next thing. Do not sit there and ask them, does anybody have any questions? Does anybody have any questions? After every slide. Don't do that, guys, because that's irritating, okay? If they have a question, they can ask. That you can say too at the beginning of the meeting. If anybody has any questions while the slides, you know, are being read, that's totally fine. We can discuss it at any time. So just feel free to ask your question, you know? And so that's how you start building those relationships, because some people are into school stuff and other people are not. This makes it more of a conversation so that you are not sitting here boring them, okay? It has to be as efficient and as painless as possible, okay? That's what you have to make these classes out to be. So you're going to do 3 topics, and you're going to make it as efficient as possible. Because if you sit here and try to say all these things and get after them and do all, no, because they don't know, all right? It's the same thing like how we had to tell our ortho docs when we first got them, okay? We need the injury, because if you say that they came in with pain and then you put them in a cast, what's going on? You know what I'm saying? So we have to talk about what is it that we need. We need to have what injury it was, the external cause, how did it happen? Why is this important? Again, because it could be work-related, it could be workman's comp, or it could be because of a car accident. It could be anything, all right? So we want to make sure that all that detail is there. It's the same thing with mother-baby. You got to make sure how many weeks of gestation they are. Same thing if they're having to do procedures where there's a specific number related to that procedure, like the corn removal, right? There's three different procedure codes that you can be used for that particular procedure, but we need to know how many. So that's the thing. Or if your providers are saying, I spent a lot of time talking to this patient, now you cannot query them for that. If they are saying, I spent a lot of time talking to this patient, we discussed this, we discussed that, and they don't put any minutes on there, okay, then you're going to have to go based on medical decision making, right, to get that evaluation and management level. But this is a perfect opportunity for you to talk about this in a meeting, because then you can tell them, because sometimes they don't know that they can get a level based on time. Most of them should know, but there's a lot of people that don't know that you can get a level based on medical decision making or based on time. And that is one of the most perfect examples of doing a class, is having something like this where you can get you can de-identify that particular note that you see, right? To use that as an example. De-identify it, of course, take all the patient private information out of there, take the provider's name off of there. So that way nobody knows, supposedly nobody knows, who did it. And so that way you can say, this is an example of, I talked to the patient for a long time, right? Okay, well, how long is a long time? Maybe that thing only came out, the level only came out to a 99213, for example. When in actuality, it could have came out to a 99215 because the doctor spent 60 minutes with them, or 45 minutes for an established patient. There is a difference. And you're not telling them these things so that they can code to the highest possible, what level or whatever. No, you're telling them these things so that they are aware and they know specifically what it is. Why are we doing this? Why is this needed? Okay, because they are not coders. They are not designed to be coders. Doctors and nurse practitioners and PAs, they're designed to care for the patients. Okay, we are the stewards of health information. Okay, so we need to make sure that we work with those providers to get the most detail that we can. And if they get overwhelmed with, oh my gosh, it's all of these things. No, it's not. We just need to know specifically, was it, how long was this meeting, right? You can't query them though, just saying that again. You can't query them if they say, I talked with a patient for a long time, because there's no way to definitively say how long was it after the fact, okay? If they're going to go based on time, they need to know how many minutes it was, not about 20 minutes. That's ambiguous. In the outpatient setting, we have to be direct. Was it 20 minutes? Was it 22 minutes? Was it 25 minutes? Was it 26 minutes? Was it 30 minutes? Because that changes the level, okay? So they need to understand that, all right? But obviously, we need to make sure that they understand that with all of these things, everything needs to be supported in the documentation, okay? So they need to make sure that they're saying everything that they need to say, okay? We know that they can get coding based on time, but they also need to tell us what was necessary, that this extended time was necessary, that was needed, right? Why was this needed? And so they need to know that so that they can appropriately document, and they're not just out there willy-nilly, okay? We can talk to them about those things, right? So that's just my episode for today. I could get into a really long episode about doing provider education because that's something that I love to do. But as I've said before, you need to make sure that you are being conscious when you're querying, conscious in the fact that you're querying for appropriate reasons. Do not query unnecessarily. When you're sending out coding tip of the week, that is something that's great for them because they like that little tidbits of information. I've been complimented on that so many times because they say they can go back and you can go right to the point. Coding tip of the week, modifier 25, coding tip of the week, laterality. If you have to keep reminding them about laterality, that's something that you need to tell them. We need laterality, left or right or bilateral, so that the appropriate codes can be selected, okay? But keep things to a minimum and make sure that you BCC your leadership if you need to, okay? If they're requiring you to copy them, don't put them on there where everybody can see willy-nilly because, and I'm sure everybody has their reasons for it, why they do it like that. But I think that, going above and beyond a little bit and saying, okay, you're on there as a BCC, the providers don't need to know that because you're just providing education. But it's checking off a box that you have on your internal department, because seeing a bunch of names when you're trying to address the providers is too much. I'm just saying. So with that said, I'm going to go ahead and wrap this up because it's about to cut me off. So I will see y'all next week. I will be back on Monday for a pre-recorded show, and I will see y'all then. Have a great weekend, everybody. If this video helped you, please like, subscribe, and share, and I'll see y'all next time. Bye.